Dr. Supriya Dutta, consultant physician diabetologist from Kolkata. So today I'll be talking about know your diabetes. It's a very simple thing, know your diabetes, but it's very difficult to know your diabetes because all think that diabetes is nothing but sugar बढ़ गया है or increase in sugar, but sugar बढ़ गया है. So I'm using the colloquial local languages so that it's easy to understand. So it's not all about sugar, it's increase in blood glucose to be precise. So not all diabetes is same. So diabetes, ideally, the majority of patients belong to one category, that is type 2 diabetes. More than 95% patients have type 2 diabetes and around 5% or less is type 1 diabetes. Apart from this, there are other variants of diabetes. So type 2 diabetes is actually, it is usually present in the adult population and above the age of, usually it was above 40-45, but nowadays it's seen even in younger patients, more in younger patients with the increase in the obesity and change in lifestyle. So that is actually where insulin doesn't work. It's called insulin resistance to start with, and later on insulin is a deficit. So basically insulin, you all know about the term insulin. It is a hormone secreted by the pancreas, and due to its defect, diabetes occurs in very simple terms, but it's not again that simple. Actually, there are many defects throughout the body that results in diabetes. There are genetic factors, there are epigenetic factors, means environment. So to prevent diabetes, it's a global issue. To prevent diabetes, we have to know what is diabetes. So I'll talk more about type 2 diabetes and then I'll tell a brief about the other variants. So for diagnosis, the blood glucose, there are certain criteria. The WHO and other august bodies, American Diabetic Association and as well as our own India's guidelines, RSSDI, actually it states that diabetes, you can stamp a patient as diabetes when the fasting glucose is above 126 and the postprandial or 2-hour postprandial glucose is above 200. So below that there are ranges 100 to 126 is impaired fasting glucose, and from 140, below 140 it's impaired, 140 to 199 postprandial is impaired glucose tolerance. So impaired fasting glucose and impaired glucose tolerance falls under the category of pre-diabetes. And there is also one more criteria, that is the HbA1c. HbA1c, that is glycated hemoglobin. So this is also you can find in tests. We all do these tests. So that also has a criteria. Below 5.7 it's non-diabetic. 5.7 to 6.5 it's pre-diabetic, and above 6.5 it's diabetes zone. So these are the values you must know. So about type 2 diabetes or type 1 diabetes, whatever it is, diabetes criteria. And type 1 diabetes is actually destruction of the pancreatic beta cell resulting in insulin deficit from the beginning. That is, it occurs way back early in childhood. It may occur later also, that is a different category. So type 1, type 2 and the other minor categories are LADA, latent autoimmune diabetes in the adult, that is actually similar to type 1 but it manifests in the adult and it occurs later on above the age of perhaps 25-30, and that is also insulin deficient. And there is another important variety, that is MODY, maturity onset diabetes in the young, that is a genetic monogenic diabetes. Apart from that, there are secondary causes of diabetes due to other hormonal disturbances in the thyroid, in the adrenal gland, in the pituitary gland. So those are the secondary diabetes causes. And another which is very common also in our country, that is pancreatogenic diabetes. So these are the variants of diabetes. So not all diabetes are similar. You must know your diabetes, because if the diabetes type is not known, the category is not known, then therapeutics will not be given properly. All blood glucose values high doesn't mean the same molecules will work. So today is my first expression of what is diabetes, and if you know about your diabetes clearly, then it can be treated or deferred, whatever you can say, and prevention of complications as well. Thank you for your patient hearing.